Welcome to Hope Talks. I'm Dr. Charles Montorio-Archer, President and CEO at One Hope United. Hope Talks are conversations between industry experts and thought leaders on issues of protecting children, strengthening families, and stabilizing communities. Our guest today is Jody Levison-Johnson, the President and CEO of the Alliance for Strong Families and Communities and the Council on Accreditation. And today we'll be talking about the importance of advocating for children, youth, and families. Welcome, Jody. How are you today?
I'm great. Thanks for having me, Charles. It's really exciting to be here.
It's very exciting to have you here, especially with all that's been happening with the work that you've been doing. Tell the audience a little bit about yourself and what you're doing and about what's going on with the Alliance and COA.
Sure. So I'm Dr. Jody Levison-Johnson, and as Charles mentioned, I'm the President and CEO of both the Alliance and the Council on Accreditation right now. I'm a social worker and have been working in the field for, I hate to admit this, but over 30 years, working across a variety of settings, public settings, county, state, as well as private sector, community-based organizations, and then in national environments like the Alliance and the Council on Accreditation. So, one of the things we're working on right now is the creation of a new organization that is the merger of the Council on Accreditation, or COA, and the Alliance. Essentially what we thought about is when I came to COA, the board of directors of COA had adopted a strategic plan that had among it two really important priority areas of focus that were to increase the value of accreditation and also to increase the impact of accreditation. And so my thoughts about doing that were really about offering more to organizations than an every 3 to 4 year process. That I think for some had really come to feel more like an obligation and less like, I guess, self-determination is what comes to mind. And so those ideas led me to think about conversations I needed to have about what we needed to do at COA, and had me talking to our COA's sponsoring organizations, which are member associations in our sector. And so I sat down for a conversation with Susan Dreyfus, who is the CEO of the Alliance at that time. And it really led to Susan and I thinking about how much more we could do together, that the Council on Accreditation could bring rigor and research to the Alliance for Strong Families and Communities, and that the Alliance offerings could really enhance the accredited organization's experience through their process, and that we could open up our opportunities to broader ranges of engagement beyond just accreditation or membership. So that's kind of where we would lead us to today.
Can you tell me a little bit about, you mentioned research and how that can inform a lot of the advocacy that you'll be doing. How do you see that part strengthening the mission of what this new organization is going to be like?
It's a great question. And I think what's really exciting about this is, well, I'll have to admit, first, we don't have a formal mission yet, because we're, our board meets, our new board meets for the first time next week, but we've really talked about in concept that our new organization is really intended to convene and catalyze a dynamic and inclusive, multifaceted network that leverages the collective experience of the field and the research to really spark a current in the sector and propel that continuous evolution and improvement. So as we think about this, we really think about how we can activate the power of the social sector by combining kind of what we know from the research and the literature and the data that we've collected over the years on organizations, bringing that together with actual field-informed perspective, and ensuring that that kind of infinite loop of field and research and the connection informs not only the work or the things we might do to offer to organizations in terms of learning networks or opportunities, but also really helps us to understand what we should be advocating for and what our stances should be. Here's the thing. I think honestly, for far too long, we all have been sort of complicit in perpetuating the status quo and setting that bar at sort of good enough. And I think people deserve more than good enough. And I think it's time for us, and I don't mean just you and me, Charles, I mean kind of our collective us, to really look at what we've been doing and set the bar a bit higher and really promote independence and sustainability in communities and not foster dependence. I think we really need to equip people for life and not for the next program or service or level of care. And so that's what I'm hoping our new organization can do.
I definitely look forward to participating in it and seeing what happens, because when I hear you talk about field experience, lived experience, evidence-based practice, all of that informing what we want to see in the system, I really think that this is a huge opportunity, and I'm really glad to see that the Alliance and COA is doing this. At One Hope United, our mission is to provide limitless lives for over 10,000 children, youth, and families we serve. And an important aspect of that work is advocating for better outcomes and improvements for the whole entire child welfare system. What child and welfare positions has the Alliance taken in the past that you find to have really been significant in the work that they've been doing?
I think it's really important. First of all, I love the limitless piece of your work. I think that's sort of what I'm envisioning, is that like we've put these boundaries on like what is good for people, and the limitless is really kind of inspiring. So I just wanted to say that because I think it's exciting. So we've really tried to think systemically about our policy and advocacy work, particularly when I think about like child and family welfare. And what we really want to do is work to strengthen the sector and move to a more comprehensive system and focus on a frame of prevention. So like when I think about the Family First Prevention Services Act, that represented a really big shift in our sector. And at the same time, it's really only providing preventive services to families that were already known to the child welfare system. And so I really want us to work together with our partners on, moving the policy advocacy work, the funding and the supports more to the front end. And so really thinking about what things we can advocate for. For example, the Child Abuse Prevention and Treatment Act, the community-based funds that come out of CAPTA for primary prevention are generally tremendously under-resourced. And these resources are the things that really help, I think, communities and CBOs provide the supports and services that families really need. And those are families who are potentially at risk of entering the system, not already system involved. So our work in the past has led to a 54% increase in some of the CAPTA funding. We're going to continue to work on that. Our new organization is also, the Alliance, and then the new organization is a founding member of a policy coalition that focuses on child trauma and ACEs, adverse childhood experiences. And so we really want to work on advancing federal policy and funding across the system. So behavioral health and education, child welfare, juvenile justice, really ensuring that all of those systems are informed by neuroscience and trauma-informed systems, approaches, best practices. Another area that we're going to be focusing on is also really thinking about the implementation pain points from the Family First implementation. So far, we have historically advocated for flexibilities around the Prevention Services Clearinghouse, which would allow states to draw down funding for promising and supported practices and not just evidence-based practices, because as far as I'm concerned, this is really an equity issue. The practices that can really face and stand up to the scrutiny of randomized controlled clinical trials aren't always the practices that have been tried and tested on populations of color, and they certainly aren't always the ones that have been found to be very effective, like right in communities. And then we'll continue our work, and we've worked hard in the past year on the end of the year relief package, which allowed training vouchers for foster youth and flexibilities for older youth in the foster care system to access resources, and continuing foster care supports and services during the pandemic so that children wouldn't just age out and be dropped out of any sort of support network. So I think those are some of the important things we've worked on in the past year.
One of the things that, there's a couple things in what you said that just absolutely resonate with me. And the first one being, you talk about preventative services and those who are, children and families who are entering into the system. How do we put a stopgap on that in order to be able to change the system moving forward? As a national organization, every state in the union does everything differently, has different effects about, you know, what they believe is preventative, et cetera. How will you tackle the national message of the federal government, but still dealing with the state and local governments that all seem to be doing things very differently across the sector?
It's such a real issue. I mean, I remember when I worked in New York State, the slogan was, if you've seen one county, you've seen one county. And then I worked I was a state behavioral health person in Louisiana, and it was like, if you'd seen one parish, you'd seen one parish. And then across the states, when I've done national work, it all looks different. I think one of the things we want to really do is leverage and intentionally create partnerships at the state level. As a national organization, we can't go into all the states and territories and work with state governments, but what we can do is push out the framework that says, these are the things that you state associations should be advocating for at your state level. And some of that is interpretation of requirements, because what I think is the federal statutes will establish something, and how states sort of allow that to trickle out to their community-based organizations can look very different. So what I'm hoping is that we can help, in partnership with organizations like the National Organization of State Associations for Children, help to really create sort of like, what are the talking points? What are the asks? What's the consistent way we want to approach these issues? And so people understand like what the front door is, and that the front door looks the same, even though I understand that in each state, the population's needs can be very different. And so we want that room for flexibility, and that like things to be contextually credible and relevant, but at the same time really defining things the same way, which is, you know, what is an at risk, which isn't a term I love, but how do we identify families who can benefit from services and supports to prevent them from having to enter the system? Because I think we're perpetuating the need for people to enter the system to get things that would be helpful to them. We need to be like combing and understanding, like if there are issues related to housing and homelessness and food and those and employment, those are critical issues. And if we put our efforts in at that front end, then hopefully we're not pushing people to end up being involved in a child welfare system, for example.
You know, that is absolutely one way, as I mentioned earlier, about how you will strengthen communities, is by ensuring that children and families have what they need before they enter into the system, instead of finding the resources once they're already in the system. Again, as someone, and you and I have had this conversation prior, but when you think about advocacy and policy, and you think about the advocacy for additional resources or additional services, and the advocacy around policy to change all of the regulations that inform our system, how will you find the balance between those two?
You know, I think it's going to be, a lot of that is going to be like talking to our organizations in the field. So I know we're actually planning to launch a policy priority survey across our entire network, which is now inclusive of the 300 plus organizations that were members of the Alliance, and the 1,600 organizations that are accredited through the Council on Accreditation, to really comb the field. And again, this is where that intentionality about listening to the field comes in. Is it's not just what we think in our offices and what people on the Hill think, it's what are the actual issues that are impacting our organizations on the ground. I mean, we think there are certain things that are absolutely going to be top of mind for 2021, like things like ensuring relief for nonprofits of all sizes as a result of the pandemic. I also think what's really important is state and government, local government relief, and that they're able to understand or withstand the budget crisis that's befallen as a result of the pandemic. I also think about the childcare sector, which I think is a critical issue for you all in terms of ensuring recovery for that sector in particular. And then the other thing that we've been thinking about, in addition to CAPTA, is really the fact that that schools provide a really important place for children to get access to the things they need that allow them to have access to a more successful and productive life going forward. And so we're also going to be working on advocating for a $1 billion program to provide integrated services in public schools. that allows us to meet the needs of the whole child, and carving out funding for school climate and culture initiatives, because I think, education is one pathway that leads to success for people. But if a school culture and a climate isn't one that's conducive and embracing, and that allows young people and their families to feel safe and comfortable, then it really doesn't matter. All the education in the world isn't going to help anyone who doesn't feel like they're supported in their own community. And then I think we'll, look for some of the flexibilities that have resulted from COVID-19, like telehealth. We want to continue to allow those flexibilities to provide services to people and supports, because I think that's critically important. Is asking people to come into offices has always been a barrier. And we blamed families and young people for failing to keep appointments. And the bottom line is it was just too hard to make it happen. And I think COVID allowed us to do things that we should have always been doing that we need to continue. So I think it's really important. And we're going to be listening and lifting up issues that families struggle with. Like I said, housing instability, food access, other needs like that.
When I think about what you're saying, and I knew that I was going to love this conversation, because we've recently been talking about how do we build these wraparound services in schools, because that is the front door of where all issues either come or go. And we really want to, at One Hope, to be able to build them in to ensure that we're going to be able to provide the support that people who come to us are looking for. Go ahead, I'm sorry.
It made me think about, because I think about when I was a kid. I went to school in a neighborhood. I walked to school. All of the families knew each other. Like, that sense of connection and that sense of belonging, I took it for granted as a child. But those are people, those are people that are still in my life. And so, that sense of belonging, I think you can't underestimate that. And if the culture and climate in a school is right, it provides a whole family that sense of belonging that allows them to really sort of feel like they're capable of taking care of themselves. That just gets me pretty excited.
It does as well. And I also have some issue with the word child welfare or child and family welfare, but that's a whole nother conversation.
Oh, yeah.
For another day. But I think the reason why it's called child welfare is because you understand that if you service the child, you do service the family, you do connect all the dots. Another thing that's come up this year for all of us in the last 12 months, maybe even the last 4 years, has been this issue around what I've been referring to, because I've heard about it, called JEDI. Justice, Equity, Diversity, and Inclusion. How is that going to, or those issues that are not necessarily issues that your members directly deal with, but these issues run parallel to all the issues we deal with in the communities, how is that going to inform your work?
One of the things that was, when we were getting ready to talk about this merger, we agreed to a set of principles, like what are the things that are going to need to be front and center. And equity, diversity, inclusion was one of those things that both boards of directors of COA and of the Alliance agreed to. Is we know that disproportionately communities of color are impacted by poverty and violence. And we know, even more recently with the what we see in the pandemic, access to healthcare, the deaths from COVID, and now vaccines, all of that, there's this huge system of inequities. And really what we want to do is make sure that we're always paying attention to that. And I spent some time talking with a group yesterday about some of our activities to really ensure that we're lifting up strategies in our new organization, not just through the policy lens, but in sort of the what can we do? What are the types of services, supports that we offer, that we're lifting up solutions that are really those things that break down the barriers and level the playing field. And so we're thinking about the term 2Gen, that idea of child and family. And so I think we're good at terminology, but it's how do we, if we believe that education is good for young people and leads to a more successful trajectory, that's very true of parents too, some parents have had inadequate access to education. And so how do we allow them to have access to educational opportunities that allow them to achieve social economic mobility, because they can increase their skills and have higher paying employment opportunities. And again, those things are all just compounded by race, ethnicity, and other issues of disparity that we need to be paying attention to. So I think that's absolutely something. I think the past year, has really re-illuminated these disparities that we see in healthcare, in education, and in so many different areas. In criminal justice, a whole nother conversation. And so it's really all those things that we need to be paying attention to and lifting up, both in our policy work, but then in the offerings we provide to our organizations around how they can refine what they're doing to better meet the needs of the communities they're working in.
And it's absolutely amazing that this is what both organizations decided was one of their priorities, because I can tell you, and I'm sure you know this as well, is our children, youth, and families are requiring us to talk about those 4 issues of justice, equity, diversity, and inclusion. And our workforce are looking for us to be leaders in that space as well, because as much as we service our constituents or our participants, our workforce are equally dealing with those issues, and we should be advocating broadly for that. So I'm really glad to see that that's going to be on the agenda. So how do you envision organizations partnering together? And I ask that question primarily because there are individual advocacy efforts that every organization is doing, and then there's the collective efforts. So how do you see those collective efforts becoming more of what we do as a sector, which I believe will have more traction in the places we need it to be?
I couldn't agree with you more. I think so one of the things we're actually doing, which is a result of this merger, is we are convening. We had a group at COA called the Sponsor Advisory Council, which was at the time 14 member associations, including the Alliance. So now it's 13 of the member associations in the human and social services sector. We're actually convening that group together to talk about our policy priorities, to think about where there's synergy, and to think about how we can support and complement each other. It always kills me. Well, actually, wait, no pun intended, but it kills me that gun lobbyists are better organized and more successful than we are at advocating for people's lives. Like, what could be more important than that? And so this idea of bringing together those 13 member associations and sort of saying, how can we work better together, I think is something that we can do. I think the other thing is we regularly will send out, we do now, and we will continue to send out action alerts, which invite anybody to participate in those action alerts. A few short minutes to make your voice heard. So we can always, we can make those more broadly available. They're always available on our website. The other thing, actually, going back to that school piece, is we often offer opportunities for coordinated advocacy. So actually right now we're ramping up our K through 12 reform work, and we're hosting a virtual Capitol Hill Week where we'll meet with a series of offices in late February to talk about the needs and recommendations for educational informed, which are informed by our knowledge of like child and family well-being and the impact of the pandemic on children and youth. So we'd love for folks to join us in that, and there's information on the Alliance's website about that. So I think those are some of the things that we're trying to do to kind of catalyze and convene our network and be sure that we're all sort of heading in the same direction together and connecting appropriately to each other's efforts so that we can have a clear voice.
You mentioned virtual, which obviously we're living in this virtual world. So what are some of the advocacy kind of effective ways that we can think about the work now opposed to when we were in 2019 and 2020?
Like, here's the thing, which I don't think will shock you because I know you're a person who's like this. It's all about relationship. So advocacy is about relationship, and relationship building is key. And that can happen almost more easily in this virtual world. So whereas before you used to maybe invite legislators for a site visit to your organization, you can actually still do that. You can ask the legislative offices to do a virtual site visit with you, invite some of the people that you work with to have a conversation virtually, just like you and I are doing with someone from a legislative office. You can set up legislative meetings that can be done by Zoom, which actually kind of takes away some of the barriers. You don't have to travel to DC, nor do you have to travel to the Capitol in your state. You can sit right in your living room and have a conversation with one of the staff from a legislative office and tell them about the things that you can do. So I think like those virtual site visits, and doing it like even when you don't have an ask, I want you to understand who our organization is and what we do, so that when we do have an ask, you're not just some stranger who's knocking on the door. You've established a relationship with your legislators. I think that's happy. We're always happy to provide anyone with contact information for the appropriate staff people in the federal offices, the representatives and the senators' offices, to help you in your community. So if you want that information, anybody can reach out to us through our policy office, which is easily accessible on our website.
I really love this idea of virtual site visits, which I have not heard a lot about, or even a lot of willingness to even just engage, because a lot of locations do also have restrictions on closures, et cetera. But that is a really good suggestion that I know at One Hope we will reconsider, and as well, I hope other listeners and viewers do the same thing as well.
Absolutely.
So my last question is the one I ask every guest, and you're being asked it as well. With everything that you know and everything that you want to see happen, what gives you hope?
What gives me hope is that we are a very powerful group of people with such passion, conviction, and commitment. And I feel like right now, this could be our moment. The pandemic has illuminated, as well as some of the other things that have been going on in our society, has re-illuminated some critically important issues, and people are paying attention. And so if we can organize, if we can catalyze, if we can convene, and we can come up with our voice, I think now is our chance for change. Now more than ever, I think community organizations have the opportunity to really help everyone understand that we are the solution to some of what is plaguing society and undermining the fabric of our nation, and that we want to work together to help people feel safe and connected and a sense of belonging. And I think the new administration is ripe to listen to us. So I'm incredibly hopeful about the future and what we might be able to do together.
As you know, one of my new pet peeves is the fact that there's not a platform for children and families at the DNC or the RNC. So I do look forward to, working with you and everybody at the Alliance and COA to see how we can push that agenda where people begin to recognize that there requires attention to these issues, which obviously, gives me hope that you're also going to be taking this up with me.
Absolutely.
Well, Jody, thank you so much for being here. I really appreciate your time and your energy and perspective on how we can advocate better for the people who are in need and the people that we employ. So thank you for your time today.
Loved being here. Thanks for having me, Charles.
I thank you all, and I look forward to our next Hope Talk.